let's go ahead and get started. Thank you again for joining. One of the challenges we face within this industry, especially with risk management, is really defining risk, really understanding what do we do with that risk. And with our ever-changing environment, almost changing daily right now with expectations, how do we manage that? As we change with the protocol, what do we consider necessary requirements? What do we consider minor deviations? What's acceptable to just do without approval? Does it meet safety requirements in terms of an immediate activity implemented, or should we wait? So multiple challenges in our environment today. So my background is that I've been in the industry for well over 25 years, and I've worked as a clinical research coordinator, a clinical research associate, a director, a lead, a manager, and also worked quite a bit in quality assurance, doing a number of audits myself, both in preparation for FDA inspections and then also working with FDA and sites and sponsors post-audits in terms of addressing what is expected for corrective preventive action, should that documentation look like. And then probably in the last 6 years, I've been very, very focused on risk management ever since 2013 when the guidances first started coming out. And we really started formalizing the process to more recently where the revisions came up in ICH GCP E6 Revision 2, where the language around expectations for risk management became a standard, to most recently when we've now had our pandemic and we're changing all of our practices to try to work around schedules, quarantines, travel restrictions, limited resources, limited people, limited shipping vendors, limited supply chain. So again, just really focusing on how do we continue to improve quality of life with medications? How do we continue to do development? Certainly, if we're doing COVID-19 trials themselves, those are top priority. But it doesn't mean that other people aren't still getting sick. It doesn't mean that we're still not managing cancer patients. It doesn't mean that we're still not managing pediatric emergencies of other sorts that we need to continually improve our treatments on. So I will bring you the best practices that I've seen and just try to share examples and case studies as we go through the presentation. So our learning objectives for today: to evaluate development of monitoring plans through protocol analysis for remote risk management. And I will give the caveat that I want to start with our current pandemic and the guidances that the FDA has put out around managing clinical trials in COVID-19. While not specifically focused on remote monitoring, they do have a number of questions that have been posted within the guidance documents themselves that specifically address this topic, so we'll start there. Then we'll talk a little bit more about just the concepts behind risk evaluation. What tools are available? How do we do it? And how do we prioritize? Because our priorities have shifted a little bit now in terms of just looking at a protocol and saying, well, these are the things we'll monitor on site, these are things we'll monitor remotely, to shifting in terms of how do we even collect this data in some instances. And then remotely as monitors or managers or those implementing protocols or sites, how do we prioritize the quality assurance or quality control of this data? And then we'll wrap up class talking about techniques for practical corrective and preventive actions to ensure clear communication and resolution and documentation of issues, because this hasn't gone away, and if anything, is probably magnified. Because as we rush to still continue our studies, to change our current monitoring plans, and to build new monitoring plans for our new environment, we have to be so clear about our thought process behind it. Why did we make the decisions we made? It may be very clear in the moment, but in hindsight, when we start to analyze the data, when we start to look for trends, when we start to look for outliers, when we start to make sure the data is statistically significant, we're going to need that documentation for why the decisions were made. How did we manage deviations? How did we manage the risk of those deviations? How do we proactively identify the risk in our studies? And then when things don't go quite the way we expect, how do we document? What do we do to fix, and what do we do to change behaviors?